Hi guys, so let's talk a little bit about SI joint dysfunction in pregnancy. Now, when you're pregnant and just SI joint dysfunction in general, it can be really uncomfortable. Particularly in pregnancy, your body's producing a hormone to help loosen your ligaments and joints so that you can prepare for birth. But the thing about that is that you also kind of create more instability through your body. And so, how do you combat that discomfort and also be prepared for birth? I feel like that's a pretty big question I wanted to ask, and so I did a lot of my own research. And being a Pilates instructor and somebody who's also made a career out of fitness, this is something that I'm really serious about. And a lot of my previous experience, initially out of my undergrad, involved, working in physical therapy clinics. So SI joint dysfunction is something I'm somewhat familiar with. So that being said, it kind of helps to know what the SI joint actually looks like. So here's a posterior view of your back and your pelvis. And the SI joint is where this little box is here, and it shows that it connects your ilium, which is part of your pelvis, to your sacrum, which is attached to your spinal column. Now, the joint here obviously does not look like your hip joint, your knee joint, or your shoulder joint, but it kind of lays flush between the sacrum and the ilium, and the big function of an SI joint is to create some degree of movement, obviously not hypermobile movement, but it's really important when you transfer weight between one side of your body to the next. Now, in pregnancy, when your body starts to create relaxin and it starts to loosen in these types of joints, then there's a little bit more instability there, and so that can cause some low back pain and discomfort. And you'll notice there's a lot of nerves that run through that area. So that's also another thing that's, sometimes sciatic pain can be contributed to SI joint dysfunction, but they are two different things. Now, the big question about this is like, what do you do about it? And that doesn't only go for pregnant women. I mean, anybody that's experiencing SI joints dysfunction can obviously benefit from similar movements and exercises. Now, I could do a whole separate video on specific exercises on how you can stabilize the pelvis for SI joint dysfunction. And leave a comment below if that's something you want me to make a video on. I'm happy to do. But the best thing you can do is bilateral stability exercises. The worst thing you can do is kind of unilateral or asymmetrical types of exercises. So things like lunging or getting out of the car with one leg. It's kind of similar to SPD. And I just recently did a video on this because SPD feels a little bit similar, but the instability is where the pubis symphysis is, not where the SI joint is. But it's a similar concept in terms of having to stabilize both sides of the pelvis. So, yeah, that was my little rant on SI joint dysfunction. Wanted to talk about it because I'm sure I'm not the only one. Bye.